So today I want to talk about an ACL recovery and surgery. So the ACL is a ligament that helps stabilize the knee from going forward like that. And so when they do that procedure, it's really awesome. You can start getting up and walking, but you will be in a brace. But they do unlock the brace a little bit earlier on. Now, if you had an ACL injury with a meniscus injury and they repair the meniscus will now be the limiting factor, and they'll have to have you locked out again for usually about 6 weeks. But if you don't have the meniscus repair and it's just an ACL, then we get to go through that early walking process. We get to get you weight bearing more. Here we actually have a treadmill that can offload you a little bit to help you back with your gait training and then get you back to running hopefully sooner. And we also use something called blood flow restriction therapy, which allows you to grow your muscle with much less weight as you're going through that healing process. So a pure ACL recovery is usually a very smooth recovery. We're looking to get you back to full range of motion, full strength. And you will have different options whenever you have an ACL. So there are different implications when you have different ACL grafts. So you can have something called patellar graft, which is where they pull a piece of your patella out. You can have a semi-tendinosis graft or a hamstring graft, which is this muscle back here that comes around like that. And then they're also starting to do a quadriceps graft, which is very been shown to be very promising now for especially for our young athletes. The big thing for us is once again to get that quad firing early on and then making sure your knee range of motion comes back. So if you have any questions about an ACL recovery, just give us a call here at Beyond in Franklin and Spring Hill. Thanks.